Have you ever got a severe throat pain? Was that throat pain associated with high-grade fever and weakness? And does that throat pain and fever occurs very frequently during every changing season or every other month? If yes, this is a video for you. Hello friends, I am Dr. Mehta, a consultant physician, diabetologist and a critical care specialist, and you are watching Doctor Plus, where I'll be a doctor plus something more, and we'll be talking everything about good health and everything good about health. So yes, we are talking about tonsillitis or throat infection. Now this tonsillitis, as the name suggests, is an infection of tonsils. These tonsils are a part of the lymphatic system of our body, and they are also known as the gatekeepers of our immune system. The lymphatic system functions to keep the bacteria and viruses out of our blood and keep the blood uninfected. So as these gatekeepers get frequently exposed to bacteria and viruses, in general, the infections of these tonsils are very common, and if there is such an infection that triggers the immune system, the tonsils get easily fired up, and that is what is known as tonsillitis. Now, what are the triggers for tonsillitis? What happens if you have tonsillitis? And the most important, what to do to prevent recurrent tonsillitis infections. We'll be talking everything about this in detail in this video. So as I said, tonsillitis is very common, and hence the triggers are also numerous. Starting with the most common triggers is exposures to cold winds, cold refrigerated fluids, that means water or cold drinks. Also, exposure to people having ongoing tonsillitis or active tonsillitis is also one of the most common triggers. Now, these triggers don't directly cause tonsillitis, but they facilitate the oncoming bacteria and viruses to land up into tonsils and cause the firing up of tonsils. For example, intake of cold fluids or refrigerated fluids will make the local area cold, and that will cause vasoconstriction. That means narrowing of the blood vessels and a temporary reduction in the blood supply that causes the bacteria and viruses to gain easy access to the mucous membranes and the blood vessels, and that causes tonsillitis. And when this happens, tonsils gets fired up, and in response to that they get inflamed. That means they get swollen up and reddish because they now more blood cells, that means white blood cells, to fight against those bacteria and viruses, and in that process you get the varied symptoms of tonsillitis that we'll be discussing now. So starting with the first symptom of tonsillitis is a severe throat pain, which is usually painful to rubbing type, and also some patients might have a sore throat. That is a very different type of sensation. Along with that, most patients have a high-grade fever. Yes, tonsillitis frequently occurs with a high-grade fever. Also associated with weakness, body ache, and nearly complete loss of appetite due to two reasons: because of fever and also difficulty in swallowing food and drinks. Also, these patients, while recovering through throat pain and fever, will develop cough and cold. So as soon as the cough and cold starts, the sore throat or throat pain will subside and the fever will also subside. The entire duration of this tonsillitis is 5 to 7 days, divided into two parts. For 3 to 4 days of sore throat or fever, followed by next 3 to 4 days of cough and cold. Now these duration of the symptoms may vary quite a lot depending on a lot of other factors also, where local immunity of the patient to patient along with the severity of infection decides the duration. Some patients might get cured within 5 days and some might require even 15 days. Now most of you would have got tonsillitis at least once in their lifetime, and some of you might be getting these infections very frequently, almost every month. So moving on to our last question is what to do to prevent tonsillitis. Now this is a very common problem, and it needs major changes in lifestyle along with very early initiation of medications as soon as the symptom starts. So starting with the lifestyle modifications along with medications and the need for surgery, we'll be talking everything about this in detail. Talking about the lifestyle changes, one has to be very strict about intake of cold foods, unhygienic and contaminated food, because they are one of the most common triggers that can cause tonsillitis. Now this thing especially occurs during changing seasons, and this is the time where the patients have to be more careful. Regarding medications, these patients need to start antibiotic therapies or supportive medications in form of betadine gargles or salt water gargles even as soon as the symptom starts. On the very first day of your throat pain, the medications and the supportive treatment should be started to cut down the duration of the illness. Now, even after making lifestyle modifications and medications, still if the tonsillitis is frequent, one must go for surgery after consulting their doctor. Now, why this is important is because, as I said in the earlier part of this video, that the tonsils are the gatekeepers of our immune system, and here I am telling you to remove the tonsils if it is recurrent. So, what are the risks of removal of tonsils and why one should consider to get the tonsillectomy, that is the removal of tonsils? Now here, one of the major reasons why one should go for surgery is that the quality of life that is hampered because of frequent attacks of tonsillitis. Also, it severely impairs the nutritional intake because that patient is falling sick every other month for around 5 to 7 days, and that hampers his nutritional intake, and that makes him more vulnerable to other infections also. So two main reasons: if the frequency of tonsillitis is more than 4 times in 3 months, or if it is more than 5 times in a year for consecutive 3 years, then one must consider getting the surgery for tonsils done. But then, what is the risk? The only risk is you get more prone to infections following tonsillectomy, and one must be careful enough as soon as the symptoms of infections start. So if you have an episode of fever or body ache or weakness or loss of appetite after getting your surgery done, the antibiotic regimen after consulting the doctor to avoid severe infections in absence of tonsils. So after getting the tonsils removed, one must be careful enough to make their lifestyle healthier, consuming hygienic food and healthy food so that they don't land up into having severe infections like pneumonia and sepsis. Hello friends, I am Dr. Jai Mehta, a consultant physician, diabetologist and a critical care specialist, and you are watching Doctor Plus, where I'll be a doctor plus something more, and we'll be talking everything about good health and everything good about health. Do subscribe to our channel, do like the videos and share the videos to everyone you feel this video might help. Also, do comment your doubts on health and disease, I'll be more than happy to help. See you till the next time, and do take a very good care of yourselves. Bye.